This is something many people ask me. How to differentiate between what is ADHD and what is naughtiness? Now, ADHD is a physiological condition. See, one mother, I remember, she came to me for an assessment with her child. She said even before the child was born, the kicking used to be so much, almost the entire 9 months she was not able to sleep. So you should understand that ADHD is a neurotransmitter imbalance which the child cannot help. That is his nature. Whereas naughtiness is deliberate. Naughtiness has a goal. You want to irritate somebody, or you want some attention, or you're over curious. That's why you become naughty. Many children are naughty and they grow out of it. But ADHD is not goal oriented, and it is an inherent restlessness and inability to stay calm, and it continues throughout life. It doesn't go away. But behaviorally, when you see, ADHD and naughtiness may overlap. Therefore, it's very hard to differentiate. Of course, this statistic manual is there. It's called the DSM, the Diagnostic Statistic Manual, which lists out the ADHD behavior. You can, that behavior has to be consistent over a period of 6 to 8 months. Only then we can label the child as ADHD. ADHD may require OT or medication or cognitive behavior therapy. But naughtiness cannot be fixed by that. Medication may be needed for ADHD because the child is so impulsive and overactive and so unable to restrain himself. He hurts himself very often. Then I would recommend medication. Sometimes, or let's say 50% of the time, ADHD happens along with dyslexia. That is when it is difficult to manage both, because that's when all your questions about sitting tolerance and attention span and listening to instructions and checking their work, all that happens. When it is aggravated by dyslexia, you can imagine what a challenge it poses to academic learning. So what do we do for ADHD? Discipline, structure in the day, child's day is very, very important, because anything unpredictable, as it is the child is restless and fidgety, he cannot handle it. And phenomenal patience. I think you have to be a saint to be a parent of an ADHD child, so also a teacher or a spouse, because as I said, it's a lifelong thing, and this restlessness doesn't abate with age, whereas naughtiness does. I hope this answer helped. If you still have any more questions, you can always post it and we'll see what we can discuss further about this.